In 1934, Harvard University professors W.I. Mixer and Joseph S. Barr discovered the herniated disc as the main cause of lower back pain and sciatica. They designed a technique of open discectomy surgery called laminectomy for treatment of herniated disc, which has been increasingly utilized. In the 1950s and 60s, Cloward, Smith, and Robertson presented a technique of cervical discectomy with fusion for treatment on herniated cervical spine disc. However, serious complications have been reported with those techniques by various authors. Joseph S. Barr, in 1967, in a critical speech in San Diego, said, "We must find another technique to remove disc material with fewer iatrogenic complications or failed back surgeries." Over the past 20 years, Dr. Rezaian has developed the technique of universal endoscopic discectomy, or UED, without iatrogenic complications, on 1,876 disc surgeries for 1,266 patients. Dr. Rezaian's universal endoscopic discectomy technique is called universal because it can be utilized on any herniated disc at any level and on any age. He has successfully operated on patients from 13 to 94 years old. Dr. Rezaian dedicates his UED technique to the memory of Joseph S. Barr. Now Dr. Rezaian will present the details of his UED technique.
I would like to draw your attention. Here is patient on operating room on decubitus on his side. We will inject first some xylocaine 1% for anesthetizing the skin and muscles, then 10 cc normal saline with epinephrine under control of the CR through the skin, through the foramina in posterior aspect of the disc. In this way, we will create a safe passage for passing the dilating tube, fiber-optic camera, and particularly the forceps and laser. If the disc is soft, we are removing with a forceps like here, and if it is hard, we will evaporate using Homu laser. This was the lumbar spine. This is the small hole that we have made. This is the amount of disc that we have removed. And here is a cervical spine. The patient is on her supine here, and with control of CR, double CR, again 10 cc normal saline and epinephrine is going to produce a safe passage for instrument. Here the instrument actually, the forceps is inside of the disc C5, C6. This is a workers' comp lady 2 years after the injury, still has got pain and problem in both arm. This is immediately after surgery. She says she is better, and this is only 4 days later. She's at her job, performing her job, and no scar on her neck. And this is called universal endoscopic discectomy because you can treat any herniated disc, whether in cervical spine, thoracic spine, or lumbar spine. You can do this surgery for any ages. We have done from age 13 to age 94 with great success. Now we will go to actual operating room, and I'll show you 4 patients before and after surgery on video, plus detail of 3 patients with a poster for better documentation. Thank you for your attention. Epinephrine we inject. Epinephrine we inject between carotid sheath and trachea. In this way, we will open on the neck through just a small point that can be done under local or general anesthesia. If the disc is soft, we can remove it with a forceps, and the result has been very good, and we will show in this short film before and after the surgery. We are is a young lady who has been suffering from neck pain and arm pain. We are interviewing as pre-operative to record her condition. Good afternoon, Ms. Deborah. How long you have pain? And how bad is this pain? Please explain.
The pain is bad. It's really bad. I can't do my normal house duties.
Can you work?
No.
Can you lift an object?
Mm-mm.
If I take this one, does it hurt?
Yeah.
It is hurt.
Just leave. Yeah. Can you leave it on?
Yeah. Okay. That's it. Okay. Can you turn it? This way? You
No.
cannot. Medication, and you have all did not have. All right. Patient shows numbness in forearm. I don't want to. She's. We are going to. Of her neck. This was the. Florence, please come, and Mr. Sir. Okay. Hello, beautiful. How are you?
How are you,
Very
sweetie?
good. I have planned that. Now see you after.
Yes, okay, dear. All right.
Smile, you're on
Great.
camera.
Oh, I see.
And this is the better half.
Oh, yes.
Such an
Actually,
such.
where's her half?
Okay. Where's the half? No, you're
The
good.
lesser half.
Thank you so much.
Yes,
Come
thank
here,
you.
please. and
Thank
have a
you.
seat, please. Have a seat,
What is
please.
all this now?
A little chat. A second. Mr. Session, you sit here and let my queen sit here. Okay. Okay. As a unit of surgery, this is the site of the surgery. Lady, 34 years had pain with spinal stenosis secondary to herniated disc. Patient 8 days ago had surgery, and now it's good. It's walking good. Is that how long you had pain?
He tenido este dolor en mi espalda por 34 años. Hace 8 días que me operaron. Después de la operación no tuve que tomar pastilla para dolor de ninguna clase. Y hasta ahora digo que he sido bendecida por Dios de encontrar este doctor. Es una maravilla. Me ha ayudado mucho, mucho. Y aquel que venga aquí, confía en Dios y confía en Él, que todo le va a salir bien.
Do you say this is nice.
You know, I said in Spanish that whoever come here, trust you and trust God, because I know you're going to help anybody come around here. Very
Thank
good.
Miss House, good morning. Good morning, how are you today?
I'm not feeling too good today.
You in pain?
I'm not feeling too good.
Oh boy,
It's barely making it in.
you're walking very...
How many days is after surgery?
The surgery's on the 7th, this is the 20th, so we're talking about what, almost 2 weeks?
2 weeks.
Yes.
Listen.
Oh, look at her, she's dancing.
I can't dance like I want to because he had to inject something in my knee, but where the area that I was having the problem in, I feel like a new person.
Wow.
The pain gone. Huh?
Thank God.
How long after surgery you felt better?
About 4 or 5 days.
4 or 5. And the pain gone.
Yeah.
And do you recommend this surgery for others?
Oh, I would definitely recommend the surgery for anybody that needs it. They need to get it right away. Because I was scared at first, but after I had it, I feel like a new person.
This is the side of the surgery. Thank you so much.
All right.
Really.
God bless you.
Thank
Take
you.
a picture of me.
Thank you.
I love him. He's the best doctor in the whole wide world.
After seeing those video and 4 cases, I hope that now you have been convinced that this technique is easier for surgeon, safer for patient. The result is much better, and you can consider